All right, thanks so much. Okay, folks, so we'll do a demonstration. So I have a vial here. You see the amber vial from the pharmacy. There's no label on this. I will open that up and then take out the vial. Again, this is an unlabeled vial. I just have water in here, but this is what your vial is going to look like. It may have more fluid in it. You see the rubber stopper up top. That's where we're going to puncture. Trying to adjust my screen. You see there's actually a circle in there. You're going to try and get the needle right through there. I'll show you a couple different needles and syringes. This is just happens to be a Short Comfort brand. You see here the volume, that's 1 cc or 100 units, 1 ml. This is talking about the needle length, 1/2 inch needle length right there. And then this is the gauge, that's the thickness of the needle, sort of how big around in terms of circumference, 29 gauge. I'm going to work with my preferred syringe, and again, there's no, you can do an injection with a variety of different syringes. I'm just most used to working with a 1 cc, 5/16 of an inch, 31 gauge. So I'll take one of those out. Again, we talked about the syringe, the cap. There's a cap over the plunger. Here's your plunger. And then if I remove the orange cap, you'll see the needle tip. Try to get close to my camera. You see very, very tiny needle there, both in terms of length and gauge. I've opened that a little prematurely, so I'm going to close that again. All right, so step 1, take the alcohol pad, open that up. I'll try and do as much of this on screen as possible. My tendency is to lower my arms. Okay, you want to wipe your vial top here and just make sure that there's no pathogens on top of that vial. We'll let the alcohol dry for a minute. You would then wipe the side of the penis. I've got a small flaccid penis prop here. I'm going to inject as if we're going into the left side. You want to sort of swab around the side here very generally to clean more of the area than needed. This is a little more natural when it's your own penis because it's attached to your body, so you need one less hand here. We're going to wait a few seconds. As I said, the slides recommend 30 seconds to wait for the alcohol to dry. I'm going to sit the penis down again while I'm going to draw up the medication. I'm going to just say our dose is 30 units. So I draw back. Takes sometimes you got to just move the plunger a little bit to get it going. I'm going to pull back here to 30 units to fill with air. Try and show you that as best I can. You see the 10, the 20, and I'm right on the 30. You're measuring from the top part of the plunger. All right, I've got my vial. Again, we wiped that with alcohol. I'm going to go straight in with the needle. Again, it's a little awkward for me to try to make sure I'm doing this correctly and see it, but also showing you I'm entering right into the vial there. Because of the small amount of liquid in the vial, you've got to invert all of this. I'm going to push the air that I drew up in. Maybe you can see bubbles going into the liquid. There's not enough pressure in there to push the plunger back, but I'm drawing up. I've got a little air bubble there, paying attention as I go, maybe smacking this to try to get the air to go to the top. I can pull the plunger back so quickly here that there's still a gap in the syringe. So you want to really make sure to watch closely to make sure that it's filling. What I've done here is overfill a bit. I don't see any air bubbles. I'm smacking the side here to loosen any air bubbles. And now I'm watching very closely here as I push to the gradation for 30. And there it is. I've got 30 units in my syringe. I'm going to disconnect from the vial, put the vial down. Now, as we talked about, in terms of, I'm showing you this awkward angle here with the penis, but in terms of length, I like to tell patients to go halfway between the tip of the penis and the body. So we're going to inject right about here. You can inject a bit closer to the base also. When I talked about sort of moving around to rotate injection sites to minimize scar tissue formation, you can certainly move closer to the body. You want to avoid injecting near the head or the tip of the penis. Not necessarily because you're going to hurt yourself in terms of damage, but because that's the more sensitive area of the penis. And so it's just going to hurt more. And the erectile tissue sort of changes a bit up there. So it's going to be harder to get the desired result. So in terms of the length of the penis, you're going to inject about halfway between the base and the tip. Again, I'm going to be targeting right there. And then we talked about in terms of circumference, where do we go? Well, anywhere from 1 o'clock to 3 o'clock, or on the other side or this side, that would be 9 o'clock, 9 to 11. I'm a big fan of going right straight in the side. So you want to go in sort of swiftly. You've got some thicker tissue underneath the skin that you've got to puncture. Right straight in with one push. And with this shorter 5/16 of an inch needle, you don't have to worry about going too deep. You want to depress so that there's actually a little indent right in the side of the penis. So, you know, not too deep, but with the 5/16 of an inch, it's easy to not go deep enough. So don't be afraid to push so that there's a small indent right there where that shiny silver needle meets the plastic of the syringe. That's called the hub. And so you want to push so that the hub makes a small indent. And I'm just moving this around now. Again, you wouldn't be doing this much manipulation, but I'm just moving it around all angles here so you can try to see what's happening. So you've got the head of the penis lifted up, you've pressed the plunger in, you wouldn't leave it lingering this long. Again, this I'm just talking through the example here. And then you're slowly depressing. Remember, I put in 30 units, so I'm thinking 3 to 6 seconds. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, the injection's in. When I was depressing the plunger, you might have seen the penis bows a little bit. That's fine too, to be pressing to make sure you've got to get the medication to that target area. You remove the needle. I'll put that in the sharps container in a minute. And then again, you'd put some pressure here on the penis. So you're squeezing, almost like you're squeezing a straw, as if you were trying to stop the flow of liquid through a straw. You're putting pressure there at the injection site to minimize bruising and bleeding. You could even sort of massage a little bit here. If you can see, I'm moving my fingers to help move the medication around and begin to stimulate the penis. Okay. Sometimes, you know, you can bend the needle when you're practicing. If you're entering the vial or even entering the penis, sometimes guys will go too slow out of nerves, and the needle bends. When the needle bends, my recommendation usually is to not fiddle with it anymore, to throw it away and start again. And this happens more commonly with the 1/2 inch needle. You can bend the needle when you're going in. And then sometimes guys will try to straighten it. But again, in terms of precision, you've got to get right into a very certain spot in the penis. That target area is very important. And so if the needle's bent and it's coming off the syringe crooked and then you try to inject, you're just setting yourself up for a disappointing experience. So if the needle bends when you're going into the vial or when you start to inject, I would just abandon and start over again with a needle that's not bent. In terms of onset of action, the erection should begin to develop in 5 or I would say no more than 10 minutes. Again, it helps to interact with the penis, stimulate the penis, have your mind in the right place, and keep track of your dose. From there, it's about fine tuning and about getting comfortable with the process. And most men who use injections are able to get an erection sufficient for sexual intercourse. And again, you know, I've treated thousands, if not tens of thousands of patients and helped patients become successful with injections.